Sir, this program is all about HEAL 2025. So, what is your focus? And if we talk about especially quality, is the biggest concern, as we call India as a pharmacy of the world. So, how do you see
So,
this?
so first of all, I think the way we've envisaged this forum this time, it's about care at 25. And it doesn't really mean care at 25 from a 25 FY25 standpoint. It really is to do with care at 25 over the last 25 years in India and how care is to be enabled over the next 25 years in India. So I think India has done a fantastic job in terms of access and affordability in the last 25 years. If you see the number of beds, number of cities, number of healthcare workers, today that number is phenomenal. We've doubled our bed capacity over the last 10 years. We've grown, our workforce today is the largest workforce in Asia. And the way we are dealing with patients, I think access to quite an extent in Tier 1 and Tier 2 has got solved for. Today in Tier 1, on the contrary, you have beds which are vacant. I think that one of the concerns that we've not been able to solve for in the last 25 years is the equitable distribution of beds. So today there are certain cities which still don't have the bed capacity that is required. And I think that focus has already started in the country. I can tell you people like us, we are now investing more in Tier 2, Tier 3, Tier 4 cities today because we feel, one, there is a need, and that need on account of the government schemes, the prevalence of insurance, etc. are now converting into a demand. So need and demand में difference ये होता है कि need सबकी है, ज़रूरत सबकी है, but somebody has to be able to fund it. And today the country is evolving in many ways. People understand the need for health. People have started to insure their own health. The government schemes are coming extremely handy, and I think what we haven't been able to achieve in terms of proliferation of beds in Tier 3, 4 will happen now. I think the other thing that we've done, and I would give the Indian health system quite a lot of credit, is that we've been able to get to a level of affordability which is unparalleled. India has actually taught the world quality with frugality, right? And honestly, there isn't a better country when it comes to quality and frugality going together. But going forward, life is going to be different. So जो चीज यहाँ तक लाई है आगे लेके जाएगी जरूरी नहीं है. So I think we need to envisage how the next 25 years are going to be. So the focus areas are actually, to the point you said, is quality. What is quality? Quality has to be enabled, and finally a feeling called trust has to come into the patient. A trust on the health system, that what I got was right, what I paid for it was right, and nobody else could have done it better. So I think that trust needs to be enabled as we go forward, which comes with multiple things, which comes with outcome reporting. So I think the country is getting geared up for the patient wanting to know what is your outcome in the past, how well have you done. It's just not a hospital you want to go to. You want to go to a hospital that sends you back hale and hearty. So I think that piece is going to be quite significant as we go forward. The second thing that I think we'll have to think of sustainability now. The cost of technology, global technology, is going up. And the third, I think the most liberating fact will be how is it that we can use artificial intelligence to enable predictive healthcare, because keeping well is much cheaper than getting treated. And I think as consumers, we need to understand that. It's great that our lifespan has actually moved in the last 2 decades by 15 odd years, but there's a long way to go in terms of understanding the true meaning of wellness.
So, we are talking about artificial intelligence, but the data security is also important. So, are you planning something regarding this also?
No, we're not, so I'm not an expert in artificial intelligence. I think the way I see it is artificial intelligence, whether we like it or not, is going to proliferate our lives. I'll ask you this question. Have you used any artificial intelligence platform? You must be using Copilot to write your scripts, etc. There are things that the world is doing better and is easing our lives today. The same thing is going to happen in healthcare, whether you like it or not, right? It's always good to use our data so that we can train models according to your and my DNA and gene pool. Applying something which is global may not be the best thing for us. I think that will happen, but again, we will wait for the right guidelines. We will see how it expands. I think India has a very unique opportunity. When I see today companies working on AI in the US, it's mostly around capital. But I think India can actually develop liberation in healthcare through AI for the entire world.